In the content channel, we are going to see about pharmacokinetic variability, drug absorption interactions, examples. Drug absorption interactions. This drug absorption interactions that interfere with the drug absorption usually involves by means of four mechanism and other mechanisms also it is involved. So the main one is this four mechanism. The first one is binding or chelation of drugs in the GIT. Drugs effects on gastric emptying, gastrointestinal motility, the effect of food on drug absorption. So the first one is binding or chelation of drugs in the GIT. Tetracycline, when given with antacid particularly aluminum containing substance. So this may decrease the absorption of tetracycline by forming the complex in the GIT. Second example, tetracycline, oxytetracycline, metacycline, doxycycline, when it is given with a ferrous sulfate. So this ferrous sulfate that may impose the absorption by means of chelation mechanism. On the other hand, so no interaction is observed when the iron salt is given 3 hours before or 2 hours after the tetracycline. So we can avoid this chelation mechanism. So by means of giving this ferrous sulfate iron containing substance after there is a before 3 hours or after 2 hours of tetracycline administration. Next example is norfloxacin and other oral quinolones when combined with the antacid containing aluminum and magnesium substances. So this substances, aluminum and magnesium, so that may decrease the absorption of norfloxacin and other oral quinolones. So this norfloxacin efficacy, so due to the formation of insoluble complex. So this norfloxacin particularly that is used for urinary tract infection. So this absorption, this decrease in the absorption of norfloxacin that may leads to treatment failure in case of urinary tract infection. And the next example is antidiarrheal mixtures containing kaolin with lincomycin. So results in decreased lincomycin effectiveness. And another one example, digoxin when combined with a kaolin pectin mixture reduces absorption of digoxin by 40%. So next mechanism is effects on gastric emptying. Generally, there's a metabolism that takes place in the liver. So certain drugs are metabolized the gastrointestinal tract, and only a fraction of those that reaches the systemic circulation. So after the metabolism in the GIT, so only a fraction of a drug only, so that may reaches the systemic circulation. So that may uses the active. That's a main mechanism. Slow absorption resulting from the impaired gastric emptying. So food results in a greater fraction of the dose undergoing metabolism in the gut and in a lower bioavailability. So because of this effects on gastric emptying, so impairment in the gastric emptying, so finally that may leads from there's a lower bioavailability. So for example, trihexyphenidyl when given with levodopa, so this may decreases the efficacy of levodopa. And another one example, oral antibiotics. For example, that's a tetracycline and erythromycin. So when combined with a digoxin, so this may alter the bacterial flora. So and decreases the inactivation of digoxin. Decreases the inactivation of digoxin. So then digoxin levels were increased. So because so that may decreases the inactivation of digoxin. So that digoxin levels were increased 43% to 116% by the antibiotic treatment. So leads to digoxin toxicity. And the next mechanism is the gastrointestinal motility. So for example, metoclopramide, it's generally anti-emetic drug. This may increases the absorption of cyclosporine. So this metoclopramide, when combined with the cyclosporine, so this metoclopramide increases absorption of cyclosporine due to the increase of stomach emptying time, leads to increases the toxicity of cyclosporine. Next mechanism is the effect of food on drug absorption. In some cases, administration of drug after a meal may seriously reduces the clinical efficacy. So, for example, the salivary suppression produced by propanthelin. So, generally, propanthelin decreases the salivary secretion. It may produces the salivary suppression. So, this salivary suppression produced by the propanthelin is virtually abolished. So, this effect has been abolished. So, when it is given immediately after a meal. So, this propanthelin immediately after a meal, if it is given in the sense, so we can avoid the salivary suppression. And another one example, the relative bioavailability of lincomycin is reduced. So, to about 60% when given 1 hour before breakfast, and to about 20% when given immediately after breakfast. So, compared to that observed after oral administration to the fasting subjects. And next example is the bioavailability of captopril. A potent, captopril is it's a potent angiotensin converting enzyme inhibitor. So this is used for hypertension. So this one, so this it is decreased. This content that is decreased 35% to 40% after a meal. So these are some of the examples for the effect of food on drug absorption. Thank you.